Plus, the stock in focus as well. The FDA has classified its Goa unit as official action initiated. Darshan spoke to the Joint President and Global CFO Kedar Upadhye on the company's future plans with regards to this. Listen in.
See, this audit got over in September, and while this classification has been communicated to us yesterday, we have been on the job immediately after the end of the inspection. So in the last 4 months, we have covered quite a bit of ground. So we have submitted a detailed response to them in the month of October. Another update went in the interim, and the next one is due in a couple of weeks as we're speaking from now. So I think whatever actions we have committed for in terms of various CAPAs, the work is on, from be it product quality assessments, be it training protocol, be it select equipment upgradations, the work on strengthening standard operating processes and quality governance reviews and everything. So we remain committed and quite positive, and we're working collaboratively with the agency to address all these observations. I wouldn't hazard a guess on the next steps and the timing, because that is for the agency to determine. But as I said, we are working in a quite transparent manner and in a very collaborative manner with the agency.
What will be the cost of remediation of these plants? Will it be a large one, or do you think that with the minor remediation costs, this entire plant can be turned around?
Yeah, it wouldn't cost much. Typically, the cost of compliance in itself is not very high. Unless the things escalate very significantly, which is not the case in this instance. There will be a lot of CapEx involved. We have hired a third-party agency who are leaders in this space, so a little bit of a professional and consulting cost. But I wouldn't characterize that as high at all.
Kedar, can you just give us details of this US plant that you have? What are the key products and how much % of the revenue on the total front, and how much of the US revenues does it contribute?
Yeah, see, every company does have what it's called as a saying or de-risking program, and we also have been working on it from the last more than a year or so, in fact. So many of the big products actually do have a dual site, which has been already done. The CP30s have been already implemented. So as we are speaking, not more than 2.5% of company revenues is the contribution of single source products from this site. In the next 12 to 18 months, the near term, medium term, there is no major launch coming from this site as well. I think most of the important launches are concentrated in Indore and other sites. So I think in terms of having any material adverse impact incrementally beyond what we publish in Q2 numbers, there is nothing much at this stage.
In terms of the US sales, obviously it's overall, if you're looking at it, it's just 2.5%, but your US sales is not a large chunk of your revenue. So based on the US sales for your US markets, obviously this plant is extremely important, right, Kedar? And that probably will be an impact that you will have to see on the US business.
Yeah, specifically for the US business, that's what I was saying, that most of the key products do have a dual site now. And that program has been running, and every company, as I said, has this dual sourcing or de-risking program. We have been running that for the last 1 year. So, and most of the impact, whatever marginal it had, is already part of Q2 numbers that we publish. So I think incrementally, we don't expect anything materially impacting at this stage.
Okay, my final question, Kedar, is till now Cipla has had a pretty much very clean record against the US FDA. I believe this is one of the first plants in which there has been a little trouble or an OAI that's come in from the US FDA. Now generally, if you look at it, be it your competition, the data is for everyone to see that once a plant there is some issue, the US FDA then goes and inspects all the other plants of the company. Are you looking to upgrade systems or get in your quality checks to be much thorough and better at your other plants, and are you expecting the US FDA to come and inspect the other plants of Cipla also?
Yes, we have been having agents check all of the plants in a continuous manner as part of their calendar. And you would have seen our announcement in the last week where we received the EIR for our Patalganga plant. And every plant has its own schedule of getting audited. So that work is ongoing. This is part of the business for us, and we do remain in a state of compliance and control across our overall system. This is part of the business. We have to stick to commitment on maintaining quality systems and compliance systems at the overall ecosystem.